Hi, I'm Sharrie Harlin-Davis, and welcome to this episode of Reid Beside You. And today, our first session, we are speaking with Rebecca Wood, Director of Clinical Integrity from Reid Health, and to Terry Ham, who is the State Health Information Program, Insurance Program coordinator in this area, representative rather. And this is all about Medicare. And during this time of the year, we have a big portion of our population who's very interested in finding out more about Medicare. And so welcome to both of you.
Thank you.
Actually, Rebecca, how long have you been at Reid?
I've been with Reid for 19 years this past September, and I've worked in multiple different areas, and I've been with the wellness program for a little over a year now.
Okay. And Terry, you've had a lot of experience working with the insurance programs in our area, and I'm sure a lot of people have seen you at various fairs as well as at the senior centers. So welcome to both of you.
Thank you.
And one of the first things we want to talk about that I know that's a part of Medicare are Medicare wellness visits.
Okay, so we have a couple of different types of Medicare wellness visits. We have a Welcome to Medicare visit. This is eligible, your first year of eligibility of Medicare Part B. And you have this visit with your provider. So once you're eligible for Medicare Part B, you'll call the office, schedule your Welcome to Medicare visit. You will meet your annual wellness specialist that you will have your other wellness visits with for the remainder of the years that you're on Medicare. And in that very first visit, the doctor will sit down with you. They'll go over your past medical, family, social history, review your allergies, your medications. They will go through a health risk assessment where they're asking you a series of safety questions. They'll do advanced care planning at that time, and then develop a personalized prevention plan. So any preventative exams that you need in your Medicare ages, they'll go ahead and they'll develop that plan for you.
I can't stress enough how important it is, especially the first year of eligibility, that people actually get a wellness visit, correct?
Yes, it's very, very important. It's not mandatory by Medicare. However, all of your providers are highly encouraging patients to come in because that gives them time to sit down with their provider and develop a plan to ensure that they're staying out of the hospital and they're staying very healthy during their Medicare ages.
And that first year, that first visit, that provider is involved, correct?
Yes. After the first visit, then you will be scheduled for a wellness visit in the subsequent years, and that is completed with an annual wellness specialist who's an RN or an LPN.
Okay.
Some providers decide to go ahead and just jump in the room just to say hi, and other providers just let the nurse do the complete visit.
And what can people expect during the wellness visit?
So they'll sit down with you, and it's more of an interview than a visit because we're just having a discussion. So we're talking about all of your health history. We're developing that plan for you. They may ask a safety questions such as, do you have rugs in your home? Just to make sure that you're staying safe and you don't fall, break a hip. We want to keep you out of the hospital. That's our whole plan.
Let's highlight that. I know in other discussions we've said about rugs in your home, and often with a certain demographic, people like their rugs.
Yes.
And they will have rugs on top of rugs.
And that's okay. If you have the rugs in your home, that's okay, but we will coach you on some preventative things that you can put underneath your rug so they're not so slippery and so you don't slide on those. So we just give you tips and tricks to keep you safe at home.
So we're not trying to remodel your house.
No, we're not.
We just want you to stay safe, correct?
Absolutely.
And are there any preventative testing that's done?
Yes. So if you're due for a colonoscopy, we can go ahead and get you scheduled for your colonoscopy. Hemoglobin A1C if you're a diabetic. We can do lipid profiles before you come in or afterwards. And so what we do is we have a whole list of all of the free preventative screenings that Medicare will do for you. And we go through all of those with you and let you know when the time frame is for all of those.
And how long do those tests usually take?
Well, for the test to take, it just depends on the test. However, the visit itself with the annual wellness specialist only takes about 20 to 30 minutes.
Okay.
Your Welcome to Medicare will typically take anywhere from 45 minutes to an hour.
And so what are some perks of having that done?
So one of the perks is you get a wellness bag. So every year in August, we change up the wellness bag, and we're always open to suggestions from the patient. So if you want to see an umbrella in the bag next year, just let your annual wellness specialist know that. This year we have a Reid bag. It's kind of big. It's got a zipper on the top. It's got some measuring spoons, something to put your medications in, a clip for bags of chips, for example, and a flashlight.
Okay. And so, once you have got that, what do you have to do? Do you have to show that, or do you automatically receive that at your wellness visit?
So when you call and schedule an annual wellness interview at the office, at the primary care office that you typically go to, and you're doing that visit, the annual wellness specialist will give you your bag at that time. You don't have to wait for it. They give it to you at that moment.
Okay. And so, and your goal is to keep people out of the hospital, correct?
Absolutely. So we want to just keep you healthy, keep you out of the hospital, and make sure that you have plenty of time to spend with your family and friends.
Great. And Terry, and so what does a SHIP counselor, what do you do?
Well, we don't sell insurance. A lot of people think we do. We try to educate and inform Medicare recipients of what the options are out there for them. And then we can help them. We never represent one company over another, but we also, just show them what is available and just guide them.
So you're non-biased.
Non-biased, that's right.
And just explaining all of the different plans that people would have options, and especially what's accepted at various locations. Correct?
Right.
So we work very closely with you.
Yes, we
so
do.
that you know for what's accepted at the hospital or whatever, the various hospitals.
Yes, yes. And I can give a list to the beneficiary that shows different companies and who accepts them and their phone numbers and things like that, either being a supplement or an advantage plan.
Okay. And now the open enrollment. And both of you, and we've worked together a lot, and we'll see each other a lot for the next month or so, because open enrollment is so important. And I know a lot of people, it makes people nervous. So by having getting your wellness visit with Rebecca and her team, and then making sure that people have access to you, that makes a much wiser choice in their insurance enrollment options. And you're available out in the community, aren't you?
Yes. I try to go to as many health fairs and do as many outreaches as I can to let people know that we are here for them. I'm at the Richmond Senior Center several days a month. You can just call down there and make an appointment, and we can go over, all the needs that you might have concerns about. So.
And we've had you at our Medical Mondays, where you're pretty much a staple with our fall events. So that gets people knowing it's about time to sign up. And one of the things that I wanted to highlight is the QMB program. Can you tell us about that?
Sure. QMB stands for Qualified Medicare Beneficiary, and there are guidelines, income and asset guidelines, and if you qualify, you can get your Part B premiums paid for. And then that would just come back on your check every month, so it would be like a raise to you every month. And then also, there would be help for your medications, which is on the LIS program with the QMB, and you can have no premiums for your prescriptions, or very low premiums, and low to no copays. But it's a program that a lot of people aren't aware of, so we try. That's one reason I'm out in the community at the health fairs and do the outreach, is to let you know it's available and I've got a lot of hugs from people when
Yes.
they qualify.
And I've gotten hugs just by having you at various events that people had no idea that they actually qualify
Right.
for QMB.
Yes.
And so it's almost the equivalent of, since it's being paid, getting almost $100 back in your check.
Yes.
So that's always interesting to see.
Yeah.
The now, does anything change on these different direct plans? Is it quarterly or whatever? How's that work on any of the plans that you have available? Or do they change? Is this only yearly, or will things change quarterly? How's that
No,
work?
they usually are yearly.
Okay.
And like I said, we said a while ago, the open enrollment is the time that you want to review your health plans and see if you've got the right plan going into next year. So that October 15th to December 7th is a really important time. I never tell anybody what plan to take, but we can put your plan that you have in now in the Medicare .gov plan finder, and then we can see what you have and then compare it to other plans, and we can see if you've got the best plan still.
Great.
You don't have, if you change, it just automatically changes over. You don't have to call and cancel your plan. It just automatically does that. It doesn't take very long, and it's something everyone should do every year.
So this has been some very good information for everyone to learn about Medicare, and possibly making sure that people receive their Medicare visits, their wellness visits, as well as checking with Terry or a SHIP representative to make sure that they're getting the best bang for the bucks
Right.
and with their insurance. And we want to thank both Terry and Rebecca for joining us today and on Reid Beside You. And thanks for joining us.
Hi, how can I help you?
My daughter has a fever and she isn't feeling well.
Okay, let's get her feeling better.
Receive quality care within the comfort of your own home. Reid Health Now, right beside you.
Hi, what seems to be bothering you?
Hey Doc, I got a fever and chills. I really don't think I should be on the road.
Okay, I think that's something we can help you with.
Real-time care anywhere. Reid Health Now, right beside you.
Welcome to the second part of Reid Beside You. And our guest, our second half guest, are Jesse Tittle, our sports medicine outreach manager, and Matthew Wright, our medical fitness manager of the Reid Health, with our new athletic training clinic.
Yes.
And welcome, guys.
Thank you.
Actually, both of you give us how you both came to Reid.
I started, I'm originally from Iowa. I applied here at Reid and back in 08. So when the new hospital was being built, nice fancy building, thought it'd be a great place to start my career.
And
Matt?
I grew up in Richmond, went to Centerville High School, went to college in Ohio. A position opened up here, wanted to stay local, and was lucky enough to get the position.
So there's all this new buzz about the athletic training clinic. And where's this located at?
It's located up at Reid Orthopedic Center. It's on the left wing. So when you first walk into the orthopedic center, it's on the left-hand side. There's where our waiting room is.
And how did you decide to have the athletic training clinic?
With all of our athletic trainers out at our schools, there's a lot of modalities that the schools don't have that we can provide to the athletes that get hurt. So that was just our idea of trying to be able to get the athletes back in a little bit quicker into their game that they wanted to play.
So are we mainly concentrating on the injured athletes
Yes.
and rehabilitating
Yes,
them,
yep.
more or less? And so exactly who's the prime candidate to use the athletic training clinic?
Any athlete that is middle school to college age is who we're currently seeing.
And so it's more injuries. Now, are they doing physical therapy, or what type of injuries would you serve?
We do more of the minor injuries. We leave more of the major injuries to the physical therapist. Just the bumps, the bruises, the wear and tears from games. That's more or less what we're seeing in the athletic training clinic.
And how many do you have? You have treatment rooms or training rooms? How many?
Yep. We have 4 exam rooms. That's where we do all of our evaluations before we provide any treatment. And then each room kind of has its own designation of whether, there's electrical stimulation is in one, ultrasound's in one. We have a new modality called a Thermex that is a cryotherapy unit that provides compression as well. And those are all in all those exam rooms.
And do you have weights? During the different slides that we were showing, it shows different weights or other equipment you concentrate on?
Yep, it's a complete set of Cybex equipment. So physical therapy used to be up there a few years back, and we have inherited those pieces of equipment.
And do you have certain, is there like packages that there are passes that people get that they use?
Currently we sell a 5-session pass. And that can be used anytime. There's no expiration dates or anything like that. Saturdays, there is a walk-in clinic from 10 to 2. That's just a 1-session pass. That's the only day that we do offer that. That is a seasonal time for right now. It is mainly tailored towards those Friday night football athletes, but anybody's welcome to come in during those times as well.
And we were stating how often maybe when they wake up Saturday morning, they might have had something that they didn't realize, so they want to come to see you.
Yep. Again, all the athletic trainers that are out there, the athletes, they want to stay in the game as much as possible. So some things don't hurt as much when the adrenaline's pumping.
Right.
So Saturday morning, you wake up and all of a sudden you can't move just right. That's why we're offering those Saturday
It's
hours
the
right now.
walk-ins.
Yes.
There, some of the other things that you have, we have various things within that clinic, so it's like more of a one-stop shop. So other things are available once that they visit the clinic.
Yep. We're going to eventually have massage therapy. We'll be up there. They have 2 rooms that will still be scheduled through central scheduling like your normal massages. We also have the HME store, so all of your foam rollers and ice packs and braces and stuff like that, they all sell those up there as well.
Okay, and their great slides are showing so that people can get an idea exactly what's there, so they wouldn't have to make another trip to the hospital. They could get it all in one stop. And also we have with sports enhancement.
Yes.
Tell me about that.
So the sports enhancement program is an offshoot of the athletic training clinic. It is a way for athletes who maybe aren't injured but are looking ways to improve their overall performance in their respective athletics events that are trying to get in shape for the new season coming up. Seeing that maybe I'm not as strong as I want to, or there's a guy in front of me in a position in front of me that I want to take over. How can I make myself better? We provide strengthening. Provide a way to teach them how to properly do the lifting, so safety factor. We focus on a lot of ACL prevention with that program as well, and it just overall is a great opportunity for those athletes who may not have that program available to them to give them an opportunity to join a program that they can get these gains that they need.
And I know that you work with most of the schools in our service area.
Yes.
So this is just an addition.
Yes.
For people that they want to be better.
Right. Exactly.
What's the starting age again?
So for sports enhancement, the starting age is middle school age through college. It does not have to be the local school. Any schools can reach out and come out and join the program.
How is the workout level? Do you just work with individuals or setting goals?
We talk with each athlete when they join, see what goals they want to accomplish, and tailor their workout to what they want to gain. Athletes can come in at different fitness levels, and we'll tailor to that level. So we may get the new athlete who just starting out may not know how to lift weights, and we teach them how to properly do so. Also want to teach them so they can limit injuries. But then we may take, higher functioning athletes who just need pushed a little harder, so we can tailor to any fitness level, any activity level as well.
So give me an example. If they have been training at school and they want to say, and they come in and say, I want to take it to the next level. I'm a football player. What would happen?
So they would come in and I would ask them, okay, what position do you play? Upon determining what position they would play, I would say, okay, so where do you feel you're lacking in it? And if it's a running back who may say, okay, I'm lacking in, my acceleration, my speed. Well, we have what's called a Woodway treadmill that can go up to 18 miles per hour. So we'll put them on there and start working on that acceleration, getting their speed training. We also have, if it's a lineman, can start pushing, I was also a college football lineman, so I'm able to show them, what are the proper body strengthening muscles, everything they need to do to push that next level. But we also do much more than football. We have a piece of equipment called a Vertimax machine, which is really good for those that are working on, want to train their vertical, but we can also use that machine for, constant resistance, for agility training. It's kind of a one machine that hits a lot of different targets. So we try to focus on sport-specific training with the sports enhancement, but even if you're, just a athlete or a person that wants to get in a little shape, this could be a program for you as well.
So baseball.
Yep, baseball,
basketball. You can
even
tailor it to
even
either
if
one.
you just go down to the park and just want to shoot basketballs, we get you stronger, get you better in any sport.
So we're also, when you're just properly training, what about ACL prevention? We see so many like ACL tears, different injuries with that.
Yes.
What do you do at the sports enhancement?
For the ACL prevention, first and foremost, like I mentioned earlier, we focus on properly training, telling them how to do the lifts properly so that they're not putting as much stress on their knees. We also show them what muscles are needed to strengthen to help prevent these injuries, and what are some techniques that they can bring to their sport to help limit it. Most of the time you'll see a lot of ACL injuries when they're landing on one knee, and so we try to work on putting them in these situations to get them stronger and how to do it properly. We also, if it's a newer athlete that may be new to a lot of the strengthening, we'll see, let's see your form. Okay, your knees are caving in, this is how you prevent that, some things to watch out for.
And once again, there's packages available?
Yes, we have multiple packages available, and we have team packages. So if a coach is looking for a whole team-wide exercise package thing, we have that as well.
I'm going to ask both of you, name a success story that you've had.
There's a lot. Maybe not so much from the athletic training clinic just because it's new, but just being on the sidelines, getting somebody. I've had somebody that was in a car accident, and we had to completely retrain them how to walk before they could go back into volleyball. So we can go something as crazy as that. But sometimes it's just, it's the little ankle sprains that linger for a long time, and you can get that to be pain-free after a while.
Pain-free?
Yeah.
Wow. And you, Matt?
So in the short time that we've had the sports enhancement program, we've actually had an athlete who started, relatively good shape, but started noticing that when they were doing their strengthening, their knees started to cave in. So, in this athlete, she's young, we caught it early and helping correct that form to prevent any future knee injuries for her as best as we can.
So I'm sure that's wonderful.
Yeah.
As well as also Reid employees can also come, and we have a lot of families involved in sports so that they can come and utilize the service as well.
Yes.
Correct.
Yes.
Great. Well, we want to thank you both for being with us today, and I'm sure, and if people want to get in touch with you, we have the information, and you are in the physical therapy building.
The Reid Orthopedic Building.
the Reid Orthopedic Building. And you're to the left.
To the left, correct.
From the entrance, and people can see that from 70. So, and most likely behind Frickers. That's the easiest way we always explain it.
Yep.
So,
Yes.
we want to welcome and thank. We want to thank both of you for being with us today.
Thank you.
Thanks,
My
Matt.
pleasure.
Thanks, Jesse.
Thank you.
And thank you for joining this episode of Reid Beside You.